recent legislation we've passed to address the effects of the pandemic on families, students, and small businesses. Remember, if you have a question, please dial *3 at any point, and you'll be added to the queue for questions. Back on March 4th, Congress passed and President Trump signed into law an emergency $8.3 billion spending package to fund the response to the coronavirus, including funds for vaccine development and support for state and local governments. Then on March 13th, we passed the Families First Coronavirus Response Act, and this past Friday we passed the CARES Act, Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act. The spread of COVID-19 will present an increasingly severe challenge for students, workers, and businesses and families across the country, and these legislative packages will help ensure that we're prepared for months ahead. The Families First Coronavirus Response Act ensures that universal access to no-cost COVID-19 testing by requiring all health insurance plans to cover the full cost of COVID-19 testing for all U.S. consumers. It also prevents children from going hungry during the public health crisis by providing students who would have otherwise received meals at schools with food assistance. And it should not be difficult, because what we have envisioned is that school systems will do exactly what they do in the summer in feeding the children. This legislation also expanded access to paid leave during the public health crisis. We must ensure that workers are not forced between their paycheck and their health. This is a critical step forward towards protecting families' financial security and mitigating the spread of the virus. The CARES Act is the latest legislative response that we passed on just Friday, focused on further mitigating the economic impact of this pandemic through direct economic stimulus. The amount of the rebate you will receive depends on your family income and family size. The rebate payment is $1,200 for each adult individual and $500 for each dependent child under the age of 17. The advance payment of rebates is reduced as your income goes up over $75,000. There is no earned income requirement to be eligible to receive the rebate. Social Security recipients will receive a rebate. However, non-tax filers will have to file additional steps to receive their rebates. Social Security Administration will share information for Social Security beneficiaries, and IRS, Internal Revenue, IRS will help ensure that these beneficiaries receive automatic advance payments. The IRS will conduct public awareness campaign to reach other non-filers and provide them with information on how they can access their rebates. The CARES Act also includes an emergency expansion of unemployment insurance through the Federal Pandemic Uninsurance Compensation to supplement state unemployment compensation benefits by $600 a week in order to fully replace wages for the average worker. For more information on that, please visit www.irs, that's for Internal Revenue, www.irs.gov/coronavirus. We also included significant relief for small business owners. Thanks to the CARES Act, there are multiple programs which are being set up to help small business owners. The Paycheck Protection Program provides $349 billion towards job retention and certain other expenses for small businesses. Small businesses are eligible, and eligible nonprofit organizations, veterans benefits, and tribal businesses, as well as individuals who are self-employed or independent contractors, are eligible if they employ no more than 500 employees. And just as a reminder, if you have a question, hit *3. If you have a question, you'll be added to the queue. Specifically eligible recipients may qualify up to $10 million in relief as determined by an 8-week prior average payroll, plus an additional amount. The loan payments can be deferred for 6 months, and the SBA will go through the details in working that out. There's also an economic injury and disaster loan program, which will provide assistance that can be used to pay immediate expenses during the emergency, including an advance payment that does not need to be repaid. The program can be used for a wide range of needs, including keeping employees on payroll, to pay for sick leave, rent, mortgage payments, or other business obligations. And it's estimated that up to 1 million small businesses may be eligible for that program. To find out how to apply, you have to visit the SBA.gov, www.sba.gov, and click on coronavirus relief on the front page. Now, we know that small businesses and families were feeling the effects of the pandemic, and we're hopeful that the CARES Act will ease the burden for everyone, especially people with student loans. I'm pleased that the final version includes some temporary student loan relief and defers all loan and interest payments until September 30th. We also know that the states will be leading the effort in ending the pandemic, and that's why the CARES Act provides resources to state and local governments, including direct aid to states and localities that are being hardest hit by the pandemic. Now, Governor Northam has already taken a number of steps to respond. He has ordered all K through 12 schools in Virginia to close for the remainder of the school year. Additionally, he's ordered the closing of all non-essential businesses, and just today he ordered Virginians to stay at home until June 10th. This means that nobody should leave their home unless it's for an essential work, food, medical reasons, or for other essential reasons. Grocery stores, pharmacies, and other essential services such as police, fire, and trash removal will remain open. Now, the State Corporation Commission has also issued an order directing utilities it regulates, such as electric, natural gas, and water companies, to suspend all service disconnections for 60 days and to provide immediate relief for any customer, residential, or business who may be financially impacted by the pandemic. I'm pleased that Democrats and Republicans came together to pass this bill and to provide aid and relief to individuals, families, students, and small businesses through this difficult time. Now, we have two experts on the call who will make brief comments. Dr. Lane, who's Superintendent of Public Instruction for the Commonwealth of Virginia, and Dr. Jordan Asher, who is the Chief Physician Executive at Sentara Healthcare, and we'll first ask Dr. James Lane, Superintendent of Public Instruction for the Virginia Department of Education, to make remarks at this time. Dr. Lane.
Thank you, Congressman Scott. Thank you. Thank you so much for having me this evening. On behalf of the Department of Education, we appreciate this opportunity. And Congressman, thank you so much for the CARES Act. The funding that will come to support our school divisions will be a huge help, and I'll describe some of the activities we'll be involved in through the next few moments. But as you mentioned, to ensure the safety of the citizens of Virginia, Governor Northam did close all schools for the remainder of the academic year. And while health and well-being of our students remain the top priority, the Department of Ed also recognizes the incredible strain that extended closures have placed on our parents, our communities, and our local school divisions. Like all educators, the Department of Ed is devastated that the school year has ended so abruptly and disrupted the lives of our schools, our staff members, our students, and our families. Child care centers in general are not impacted by the governor's order. These sites are making closure decisions in coordination with their local health department. But Governor Northam has asked our daycares to prioritize essential personnel and adhere to social distancing, new cleaning protocols, and limit group sizes to under 10. Additionally, to ensure that all essential personnel have child care, we have begun asking our school divisions to prepare plans for child care as well. We know that the impact of students and families during extended closure is significant. The learning time and support students receive at school are not easily supplemented or replaced. Understanding the desire and responsibility of parents and educators alike to provide continuity for every student in their thinking and learning, many school divisions are thinking different ways about how they might offer learning. Some are doing online, some are doing distance, remote, and the key for us is that we're focusing on equity and making sure that every student is served throughout this time. And so we've spent a lot of time issuing guidance to our school divisions. Just last week, we issued new guidance on graduation requirements to ensure that our seniors, our 12th graders that are on track to graduate as of March 13th, will graduate without issues. And then those students that maybe were not on track to graduate, we laid out guidance to make sure that our school divisions are helping those students make it over the line. And so as we do this new instruction over the next few months in this new setting, whether it's correspondence or virtual learning or distance learning or however it's being done, we just want to ensure that our students are served equitably, regardless of their income level, their access to technology, their English learner status, or whether they're a student with disability. We want to make sure that every student is served during this time. And so we've spent a lot of time giving our school divisions guidance on how they can do that, whether that's now during the closure through virtual or correspondence learning, in the summer, or embedding it in the next school year. And as I mentioned, we're heartbroken for our 12th graders, our seniors. This is a time of great celebration for them, with graduations and prom, and a lot of the rites of passage that we've all known in public schools for years may be disrupted, delayed, or maybe even done in some new way. But we're committed at the Department of Ed and are working closely with our Board of Education to ensure that our seniors graduate on time. And so we've already provided waivers as allowed in the executive order on a variety of issues. We have other waivers that we'll be seeking from the Board of Education this Thursday. And some of it will require General Assembly action, which we'll do in the reconvened session on April 22nd. For students that are not 12th graders, and for students that are in K-8 and in grades 9 through 11, we are asking our school divisions, if students were on track as of March 13th, to make sure that those students are promoted to the next grade level or to the next sequential course. We are asking our schools to document the missing learning that a student may experience between now and the end of the school year, and create a plan for every student to make up that time, whether, again, that's done now or in the summer or even into next school year, because we don't want there to be permanent gaps in learning because of the decision that we made. It is done by contacting your school division, but we can help you from the state level as well. One of the most common questions we've gotten is about state SOL testing, state testing. And I'm happy to announce that the U.S. Department of Education granted our waiver just this weekend to cancel our SOL assessments. And the federal government mandates assessments in reading, mathematics, and science. And so then the rest of the assessments that your students may take will likely be waived when the General Assembly meets later this month. That also allowed us the flexibility to waive the verified credit requirement for a diploma for our 12th grade students. One thing that I want to note is you did hear about Governor Northam's stay-at-home order today. And I just want to make sure you know that does not impact your ability to pick up meals from your child's school. Our school divisions will continue to serve food. We have received amazing waivers from the USDA and the federal government to provide a lot of flexibility in this space. And whether it's instructional packet pickup or meal pickup, that all is allowed in the governor's stay-home order. In his stay-home order, he specifically references the ability to go out for food needs and to go out of your home to visit as educational institutions. And so last piece I want to say is just a reminder, we have a great website that the team at DOE has put together. It has a parent guide, and so if you're a parent in the community, you can check out that guide. We lay out a lot of these things in there so that parents can know how to navigate the situation. We also provide guidance on how you might structure time at home if you're working with your child on some of their learning. This is an unprecedented time, and we're heartbroken that schools are closed. But I can tell you there are amazing stories of heroes out there too. We have teachers doing amazing things for our students, schools delivering food almost door to door to families, or providing new and innovative ways to do that. And so through this tough time that we will have in the next few months, know that the system of education and your local school division and the Department of Ed is there for you. So Congressman Scott, thank you for the opportunity to share a few remarks.
Well, thank you very much, and appreciate your comments and all you're doing for the students. Dr. Asher, Chief Physician Executive at Sentara Healthcare, what do we need to know?
Thank you, Congressman Scott. First of all, I am honored and blessed to be part of this conversation. I really am very proud to be a Virginian and specifically living in this area. As many of you know, Sentara Healthcare has over 12 hospitals across the Commonwealth. Specifically, in the areas of this district are Sentara Williamsburg Medical Center, Sentara Careplex, and Sentara Norfolk General Hospital, which is our level 1 trauma center. We are very focused on how to support those that require our care, as well as the community as a whole, and are doing many things to help the community out during this difficult time. We had we had begun to plan for this the first time we heard there was a positive case in the United States. Our teams and our staff are incredibly dedicated to taking care of those, and I want to first thank anyone on this call who has a family member that is a healthcare provider. Everyone that works at Sentara is part of a team that is focused on not only the safety of those who work, but the safety and care for those we serve. Since our last call, as many of you know, we've had community drive-through testing at multiple sites throughout the area. We are working with other health systems and community partners to make sure we take care of you, not only when you're sick with a medical condition, but also supporting the other needs in our community. Once again, I am very humbled to be here, and in order to leave time for questions, I am available to answer any question as it relates to health and wellness.
Well, thank you very much, and the people on the call will be delighted to know that a politician won't be answering calls about health care, that we have a physician, so you'll be getting all the health care calls. Austin, we're ready for questions.
Okay. Thank you very much, everyone. And just a reminder, if you'd like to ask a question, please hit *3. Now we're going to move to Angela from Newport News. Angela, you're on with Congressman Scott.
Thank you. My question regards a job furlough where there's no pay and no insurance. So how does someone pay their rent and their bills and buy food? What can someone do? Any places they can go to get help?
Well, you have the regular people, Salvation Army, churches, and things like that. But one of the things we've done in the legislation is do the best we can to continue your income. If you were laid off, you're eligible for ordinary unemployment compensation, and that's available. But in a few days, possibly a week or two, you should be eligible for the additional $600 a week. They'll be available for anybody on unemployment compensation under the federal legislation. In addition to that, in about 3 or 4 weeks, the cash payments will be available. That's $1,200 for each adult. So between those, most people will be able to maintain their income, and the value of that, the one-time payment is nice, but the main is important. But for the duration of the pandemic and the duration of your unemployment, most people will be receiving unemployment about what they were making before they were laid off. And by maintaining the paychecks, we eliminate a lot of the problems. Obviously, if you don't have a paycheck, you can't buy rent, you can't buy food, you can't pay any of your bills. If you have your paycheck coming in, those problems do not occur, and that's why it was so important to significantly increase. I mean, the maximum unemployment in Virginia is about $300 and some a week, which for most people is totally inadequate to maintain their rent, buy food, and things like that. But with the $600 extra, we believe that the average employee will be able to keep up with their bills. Obviously, the signing up for it is going to be a challenge. The number of people filing for unemployment went up 100-fold across the country. We broke the record for the most unemployment compensation claims in 1 week. We broke the record last week by a factor of 5. We were more than 5 times more than the previous record, all in 1 week. So the unemployment compensation offices are going to be inundated, but they should be able to process the forms as soon as the regulations for getting the federal money come out. Now, in the meanwhile, the Virginia portion of that ought to be available now. You don't have to wait for that. If you just apply with the unemployment compensation office now, you'll be able to get at least the Virginia part. They probably have to have a few days to process the federal part, but at least get the Virginia part. They have waived the 1 week waiting period. Usually you have to wait a week before you can apply for unemployment compensation. They've waived that, so it's available right off the bat.
Well, thank you very much. I appreciate it.
Okay.
Great. Next, we are going to move to Karina from Norfolk. Karina, you're on with Congressman Scott.
Yes. I did not file taxes this year. I am on Social Security disability, and I was wondering if you're receiving disability, what steps do you need to take to receive the $1,200 check?
Hopefully, the Social Security Administration will be working with Internal Revenue to make sure that everybody covered gets a check. If you don't get one within a few weeks, call my office and we'll try to track it down. But they're supposed to be working together so that those checks can go out. If you have direct deposit, it'll go right to your checking account. If it has to be mailed, it'll take a couple more weeks to print all the checks and send those out. But if it's a direct deposit, it's the computer takes care of that, and it's a fairly simple process. But yes, SSDI recipients are eligible for the $1,200.
Okay, thank you very much, sir. You have a blessed day.
Thank you.
All right, and for everyone that is curious, you can hit *3 if you'd like to be added to the queue. Next, we're going to move to James from Newport News. James, you're on with Congressman Scott.
Yes, I'm a disabled veteran 100%, and I don't pay IRS taxes because my income was below the level. My wife is on Social Security, though, and I get disability retirement from Norfolk Naval Shipyard, which is still below the filing limit. Is there going to be some special thing done for disabled veterans, 100% disabled veterans that do not pay taxes?
We'll make sure that the VA coordinates with the Internal Revenue Service to make sure that all those names get on the list, because everyone is supposed to get, whether you're working or not working, you're supposed to get the $1,200 rebate. So we'll make sure that the VA is coordinated. They should be coordinating with the Internal Revenue, so those checks should go out.
I appreciate your time, sir. You have a good day.
Okay.
All right, next we are going to move to Sherry B. Sherry, you had a question about small businesses? You're on with Congressman Scott.
Thank you. First of all, I wanted to thank you, Congressman Scott, for your leadership. When Speaker Pelosi was about to call for the vote, she said your name about 3 or 4 times. And so clearly you've done some wonderful work, hard work with all that is going on, and I thank you very much for that. My question is, our company, a nonprofit, was already in the process of making a loan application to a local bank. Now, at this point, do we continue that, or do we resubmit through the Small Business Association in terms of applying for those funds?
Work with your bank, because the Small Business Administration is trying to work with local banks. As I said, 1 million businesses may be eligible, and one agency is not going to be able to process all those forms. They want to work through banks to process the forms. So work with the bank and make sure that they are taking advantage of the Small Business Administration. But don't start from scratch. Don't try to start from scratch. Just make sure that, just ask them if you'll be eligible for all of the benefits under the SBA loans, part of which is that some of it you won't have to pay back, so you don't want to miss out. You don't want to miss out on that. And in reference to Ms. Pelosi's comments, I chair the Committee on Education and Labor, and when you talk about issues affecting people, just about all of it goes through our committee. So the worker rights, the unemployment compensation, the family leave, the education benefits, worker protection, all of that comes through the Education and Labor Committee. So I've been busy, and my staff has been working overtime.
Indeed, you have been, and you've left out prison reform in terms of what's also on your plate. So thank you for that. One more quick question in terms of the Centera representative there. With our events, we want to make sure that we include testing for the virus as a part of our events. Is that something that is doable for groups that are not medically trained, or as long as we have a medical personnel there, then will you be able to do something like that?
We continue to work on throughout the country as well as this area how to increase the testing. Right now, because of supplies, we are focused on testing those that are sick and those that have been exposed, as I mentioned earlier. As testing becomes more available, we'll be working with the Commonwealth as well as others in the communities to see how we can expand the testing and how that testing gets done. Obviously, being able to, when we talk about screening and testing, there's the component of running the test, but also the component of how do you do the test or take it or use a nasal or oral swab to get it, which will obviously take training. But to answer your question specifically, over time, hopefully that will happen, and we continue to monitor that on an ongoing basis.
Thank you.
Great. Now I think we're going to move to an online question. So T. Parker asks, will the children of Virginia have to repeat their current grade level upon returning to school for the 2020 to 2021 school year? How will they be assessed upon returning, and how will the children be graded while they are currently out of school?
Dr. Lane?
Yeah, thank you, Congressman. Thank you for the question. The students should be promoted to the next grade level if they were on track to graduate at the time that we close schools, which is March 13th. And that is the same for promoting to the next grade level or even going into the next course. If students were not on track to be promoted as of March 13th, then our guidance that we've issued, which you can find on our website, asks our school divisions to create a plan to help students get to passing the course by the end of the school closures. Now, obviously, we can't fully replicate the school experience even in a remote or distant setting. So we've asked our school divisions to essentially document all of the learning that students will miss from March 13th to the end of the school year and create a plan for every student to make that time up. And so we've heard some school divisions are doing that instruction now, whether it's in a virtual setting or they're doing packets and sending them home, or even I've heard of school divisions putting packets on school buses and delivering them to the house. Other schools are looking at adding some time in the summer to make up gaps, and other schools are looking at embedding it in the next school year and maybe even into the second summer. But ultimately, we've given divisions plenty of flexibility for that. The big thing is that we just want to make sure that every student is served, and no student should be retained or just because of the school closures. Our expectation is, with almost all of our students generally on track by March 13th, we expect that our students will be promoted, be able to move on to the next grade level, and we'll fill in those gaps as much as we can.
Dr. Lane, can you say a word about what WHRO has available?
Yes, absolutely, and we have, yes, sir.
WHRO. Most of the people on this call are in Hampton Roads.
Yes, sir. As you know, WHRO is the public TV and radio affiliate in the Hampton Roads area. They're actually a very close partner with the Virginia Department of Education. We actually partner with them on a number of projects. But WHRO has virtual courses built for most of the courses that your child would want to take during a school year. And so this is a perfect time with schools closed, if you have the ability to access learning virtually, to tap into their free coursework. They're offering their coursework free to every school division, not just in their service area, but throughout the Commonwealth for the rest of the year. For teachers on the call, they have a platform called eMedia VA, where they have thousands of learning items that you can pull from. And since I'm filling that gap in, Congressman, we also have in the Commonwealth Virtual Virginia, which is our statewide virtual school that we provide and is open to all of our school divisions. And then just in January, before the coronavirus issue hit, we launched what we call Go Open VA, which is an open education resource platform that has over 10,000 learning items in it that parents can tap into. If you check out our website, we've listed a ton of the free resources that are available to our teachers and our parents, but absolutely one of the best in the state is right there in the Hampton Roads area with what the WHRO is doing with their virtual learning coursework.
Good, thank you. Austin?
Great. Next, I think we're going to move to a question from Facebook. Laverne Johnson wants to know, do you have to have health insurance to get a test for COVID-19?
Legislatively, we passed legislation that makes testing free of charge. That is, if you have insurance, there's no copay and deductible, and if you don't have insurance, you're not supposed to have to pay anything. That's because we want to encourage testing when it's available. As Dr. Asher indicated, we have a shortage, so the tests are too limited to at this point. But when they become much more available, and we do things like tracing contacts, if you find a person that has been tested positive, you want to also test the people closely around them. We can't do that now because we don't have enough tests. But when we do it, we don't want to have to have people pay the fee for all these tests. There'll be no cost at all. We also have a provision that vaccines, if they're ever available, will be without copay and deductible. And finally, we want later on in the next bill, we couldn't get it in this bill, to make sure that treatment is also available. If you've heard of people needing ventilators and ICU units, I can guarantee you that those are going to be significant bills. We want those who are in that situation to have their COVID-19 related expenses paid for so that people aren't going bankrupt during this pandemic. Dr. Asher, do you want to add anything to that?
Completely agree. And as a healthcare system, we obviously very much agree with that and are working with the appropriate people to make sure nobody gets an inappropriate bill. And just to the point, we had been able to start our testing for the communities. Every day's running together right now, but for a while, and that has been true from day one. What you just said.
Great. Everyone, you are on with Congressman Bobby Scott. He's holding a telephone town hall on COVID-19. Next, we're going to move to Wanda from Hampton. You had a question for Congressman Scott?
Yes. My question for Congressman Scott, and good evening, everyone. I am a regular 10-month full-time employee with the Hampton City School System, and during the time off, during the two and a half months that we are out of school, I normally go and find me a job over the summer because my income is not enough to, from the system anyway, for me to pay my bills during that time. And I would like to know whether or not during that time, because of this epidemic, will I be eligible for any unemployment or any other state assistance because of that?
I assume you would be eligible for unemployment benefits during the summer when you would have worked, but you can't. That would be talk to the Virginia Employment Commission. You would be eligible for unemployment compensation, plus you would be eligible for the $600 a week additional federal benefits, and by this summer that ought to be up and running.
Okay, because normally as a Hampton City School employee, we are not eligible for any of those state benefits during the summer months. We're not eligible at all because I've tried several times throughout. I've been with the school system over 12 years and have been denied every time. So we're not eligible for those benefits. So because of this, you're saying I may be eligible for it now?
You may be, but let me check on it. And we have. Austin, do you have her number?
Yeah.
Don't recite. I think we have your number, so we'll get back to you. But I assume that if you were looking for work at that time, and can't find work, that you would be eligible for unemployment compensation. But we'll verify that with the Employment Commission.
Okay, thank you very much, and you all be safe.
Okay.
Thank you, Wanda. Next, we're going to move to Linda. Linda had a question about dogs and cats. Linda, you're on with Congressman Scott.
Hi. Good evening, everyone. I had two questions. One is related to animals, like dogs and cats. This is for the doctor. Is there any chance, or have they found out if humans can catch it from animals, dogs and cats mainly?
So the literature to date, there's been no information showing that it is in pets or animals, at least dogs and cats. So right now, we do not believe so.
That's good to hear. And the other question I have is, if we're retired, and are we eligible for the $1,200 per person, per household?
It's not per household; it's per person. And yes, you are. If you file taxes, you'll get it through that way. If you haven't filed taxes, there may be some forms you need to fill out. But every adult is entitled to the $1,200.
Okay. Thank you very much. I really appreciate all y'all's help and all y'all's hard work.
Thank you.
And as a reminder to anyone, if you'd like to be added to the queue, all you need to do is hit *3 at any point during the call. Next, we're going to move to Thomason B. from Norfolk. Thomason, you're on with Congressman Scott.
Good afternoon, Congressman Scott. Been with you a long time. Love you. My first question was about the kids in school. We have the kids that are be raised by great-grandmoms and grandmoms, and they may not have access to computers or electronic things like that to help them catch up with their schoolwork. And libraries being closed, and so I kind of heard some of the answer. With other people talking, but I'm just saying, how would they, even if it resumed back in the summer, how would they access, this? Where in school they have computers to do the work. But being at home and not having anything there to do it with.
Well, legislatively, we provided money to the localities to help deal with the situation. Obviously, you've identified one that is going to be very difficult to solve, but I'll let Dr. Lane, you want to deal with it?
Yes, sir. Thank you. Ma'am, thank you for your question. As we've been giving guidance to our school divisions on how to implement the learning during the closure, or even supplementing the learning when we return in the fall, we have asked our school divisions to make sure that virtual and online learning is not the only methodology that they're using. So many of your school divisions will have a virtual option where they'll be asking students to do something online, but they'll pair that with a packet or correspondence for students that don't have access. In fact, we have some school divisions, not necessarily in Hampton Roads, but as you get into more rural areas, especially Southwest Virginia, where there's no internet access at all, and all of the student work is being served in a way that is, like I said, either packets or other instructional materials. And then some school divisions fully recognize they can't do everything in a distant setting. And that's why we think some of our school divisions will make plans to bring students back in the summer so they can get face-to-face. But our goal is, it doesn't matter if you have the internet or not. We're going to do whatever it takes to fill in the learning gaps that students face. And like I said, there are going to be many ways they do that, whether that's now through these packets, in the summer, and on into next school year.
And you've identified a lot of the problems. That usually you go to the libraries are closed. Your boys and girls clubs are closed. Even you can't encourage churches to have programs because you're congregating people all in the same place. So this is a very difficult problem to solve. We recognize it, and Dr. Lane is going to be doing what he can. We gave him a little extra money, not nearly enough, but we know it's something we need to address.
Okay, yes. I got one more little small question I want to ask. I'm on disability, retired disability. My daughter carries me on her tax, and I know they say everybody, even SSAs, are titled to the $1,200. But if she carried me on her tax, how would I fit in? Would I be one of her dependents as a $500 person?
Well, I assume you're not under 17, so
No.
You have to be under 17 and a dependent to get the 500. You should be. I'm not sure. I'm going to have to get back to you. Austin, do we have the number? Austin.
Yes.
Okay. Jot down the question. Make sure we respond to her.
Okay.
Okay.
Will do.
Okay. All right.
Thank you.
Thank you so much.
Next, we are going to move to Betty from Suffolk. You had a question for Congressman Scott, Betty? You're live now.
Random people, what they paid for in rent, and then paid it themselves.
Betty? You there?
Yes.
You're live now with Congressman Scott. I think you got your TV on in the background, maybe?
Yes, I was asking about the homeless people. What is being done for them? How are they being fed? And also, how are they living? And being
Okay. You're a little hard. You're kind of breaking up a little bit, but homeless people. I mean, that was a problem before the epidemic, and obviously a problem now. But one of the things, there's significant funding in there for food banks and other organizations that help the homeless, and hopefully they will be able, with the increased resources, be able to reach out even more than they do today. But we did provide resources. There's also some local assistance under the Community Development Block Grant, which can be used to help the homeless.
Great. Next, we are going to move to Terry. Terry, you had a question about unemployment benefits. You're live now with Congressman Scott.
Hi, thank you. So my question is, well, first, can you give me the website again, where we could find like a Corona pandemic relief and everything, and a file for unemployment there? Is it www.irs, and then I missed the rest of it?
/coronavirus.
Okay, www.irs, and then /
Wait, I'm sorry. .gov. .gov / irs.gov / coronavirus.
Okay,
so
gotcha.
I have two questions. So I just recently separated from the military in February, and my wife, when we filed taxes, we filed jointly, but so my wife wasn't working and I was the only one working active duty. So are we both gonna get is it $1,200 with it, or is
yes, if you file jointly, it'll be $1,200 and $1,200, total of $2,400, plus $500 per children under 17.
Okay.
If you file jointly, that's two people.
Okay, roger that. And another question is, so if my wife, you can ask? Okay, I'll hand it over.
Hi, it's me again. Thank you for the answers that you've provided us so far. And our next question is that, so last year I wasn't working, but I filed jointly with my husband, as he's already told you. But this year I did start working in January, but of course, per government, I guess, mandate, we the nail salons, barbershops had to close down to adhere to the 10, don't gather of 10 or more people and everything. So
right.
I'm currently out of work because I did work in a nail salon, and so I would find, I guess I would get unemployment as well. Correct?
Exactly.
Okay.
And
awesome.
you get regular Virginia unemployment, which is not very generous. But in addition to that, if you're getting an unemployment check, you should get a $600 additional check from the federal unemployment, a flat $600.
Gotcha. Thank you. And that is also for 1099 workers as well, correct?
We're trying to figure out a way to get that done. 1099 workers are generally not covered by unemployment compensation, so the Virginia unemployment will turn you down. And but if you apply to them, we're going to try to make sure that they will process for you the federal unemployment as a 1099 employee. And the advantage with the federal is it's a flat $600, so we don't have to go figuring out exactly how much you made, and you get a percentage of that. If you're unemployed, you get the $600 a week.
Got you. Awesome. All right. Thank you. And any more questions?
Yeah, just one more question. So the avenue for regular unemployment is the same website, www.vacompensation.gov or something like that, or
something like that. I don't know exactly what it is, but it's the Virginia Unemployment Commission.
Yeah, I'll Google it. It's fine.
Okay.
All right.
Thank
you.
you
Very much. We are going to move to Sharon. You had a question about the shipyard. Sharon, you're live with Congressman Scott.
Yes. Hi, Congressman Scott. I want to thank you for all of your tireless efforts. I think federally you are doing an absolutely phenomenal job. And I had a question about the fact that the governor has asked us not to congregate, no more than 10 people in one place. Churches are closed, restaurants are closed, and yet we have 20,000 people a day going into the shipyard and then coming back out into the community. I'm just trying to wrap my head around that. It seems like it's totally contradictory.
The national security and military defense are essential jobs. We're working on that, and that's under review as to whether or not the shipyard will get a little dispensation for not getting the ships built on time because the workers couldn't show up. It's obviously a very serious problem, and it's under active discussion now with the U.S. Department of Defense and the U.S. Department of Health and Human Services as to what's the appropriate thing to do. You have identified a very troubling situation. The ship so you assume you could be talking about either Newport News or Norfolk Naval.
Well, I live in Newport News, and of course.
So when you say the shipyard in Newport News, it's Newport News, and when you say the shipyard in Portsmouth, we're talking about something else. But either shipyard, they're under active discussion now, and you have identified a very troubling situation that needs to be addressed.
Or Northam, and then yet we have this one big mass of people that violate everything he said, and I understand the importance of the shipyard, but that doesn't really have anything to do with the numbers of people interacting. And I'd like to see this over by Memorial Day.
Well, that's a medical. You have to talk to Dr. Asher about when it's over. There are different projections about when the peak is going to be and when it starts going down. But the situation in the shipyard is under active discussion right now.
Well, and I would like to add a brief comment because obviously we have lots of healthcare workers that I sort of think about us in the same way. And I can't speak for the shipyards. But I know for us, we are very focused on making sure that we test and screen people as they are coming into work as well, which has been done throughout the country. And my guess is that the shipyard is also thinking in that methodology as well. because, as Congressman Scott said, that there is no desire to put other people at risk, especially the essential workers themselves. So I know that that is also active conversation within the context of, for example, Centera. How do we keep our employees safe? How do we keep our areas of work safe as well?
Thank you very much, Sharon. And moving forward, we only have a few minutes left, so if everyone could just ask one question so we can get to as many people as possible, that would be great. Next, we are going to move to Frank, who from Chesapeake. Frank, you're on with Congressman Scott.
Congressman Scott, thank you very much for being able to have such a town call. I've been on a couple of them, and I appreciate very much the information. I'm questioning, how do we know how long this is going to take place? We've got a lot of different dates from a lot of different people. Governor Northam has just said June the 10th. What is the magic number that we've got to get to say, look, we just got to get people back to work, because the virus is going to continue to go on probably for some time, and may even be a part of the many viruses that we have to deal with in the future. So, what is the guess?
Dr. Asher.
Congress, I wish I knew that answer. That no one really knows, especially as different communities sort of act as their own area as well. From a medical standpoint, there will be a point where and remember, lots of people might have it that are asymptomatic, so on and so forth. So you get immunity in people that have had it and might not even know it. We will get very good at, even when we come out of this, some social distancing. But there is no specific date. And unfortunately, we don't have a way to even predict what that date would be. We do have information from other parts of the world that were a couple months ahead of us. And obviously, the government is watching that closely. And I know everyone wants that answer, but unfortunately, we don't know that. I can say the best way to make sure that that date is not farther and farther away is to do everything that we have been asked to do. And that includes the social distancing. That includes not being in large crowds. Because that way, after a period of time, anyone who had it, there's basically no more virus out there in people. And so I just really, really want to support everything that is being done, knowing we don't have an endpoint, and knowing that the measures that we are being asked to do have clinical benefit to end it sooner.
Let me make another comment. This is one of the problems with a lack of testing. We have no idea how widespread this is. You get an idea by the people going to the hospital, but without tests, we won't know that we've actually gotten past it. In the last 10 days, the number of deaths has gone up tenfold. That is, it was 200 and some 10 days ago. It's 2,000 and some now. 10 days from now, at that rate, there'll be 20,000. 10 days from that, 200,000. 10 days from that, 2 million. If we don't, the best thing we can do, that's what they mean by bending the curve. The best thing we can do is follow these guidelines, staying at home, stopping the transfer, avoiding large crowds where one person can distribute it to many people. We're doing the best we can without the test. Now, once we get tests, we can do the test to find out what's going on, where, and if it's pretty well dissipated, we can feel confident that we can let up. But until then, we're on a trajectory where we could be looking at millions of deaths, certainly hundreds of thousands, and without the test, we just don't know. We just don't know when. We do know that there's no projection that we're going to be much better off by the end of the month, by the end of next month. So we're doing the best we can, and this is a matter of life and death. When people stay at home, they're saving lives. when they gather together, and you can see what happened when they had Mardi Gras in Louisiana. You're seeing a hot spot in Florida because everybody was out at the beach. When you don't follow the guidelines, it makes a difference. They had a chart. I saw a chart with Kentucky and Tennessee with the actions taken by the governors. The governor of Kentucky called an emergency, closed the schools, closed down the bars, and after that, a few days later, Tennessee called an emergency, later closed the schools, later closed the bars, and the rate of infection that started off the same in Kentucky and Tennessee, because they delayed action, have about 5 times more cases, and ultimately will probably have 5 times more deaths than Kentucky. So these actions, nobody likes the closure of these things, but the governors have to step up and take the heat and save people's lives.
Great. Next, I think we are going to move to Maxine from Suffolk. Maxine, you are on with Congressman Scott.
Yes. Thank you for the opportunity to ask a question, Congressman Bobby Scott. I have a two-part question. I'm in the medical field, and I was wondering why nurses and doctors are they being offered hazardous pay? That's my first question. And my second question is, looking at the news, especially in New York, I've been seeing where, nurses and doctors are getting sick. And I was wondering, is there something in place that if a nurse or doctor does get sick from the coronavirus, that are they still responsible for their out-of-pocket medical bills, or is that being taken care of?
What you have suggested, I mean, the physicians, the healthcare professionals are just heroic in this situation. And one of the problems that we have is one that I've been working on for several years, and that is that OSHA, Occupational Safety and Health Administration, OSHA, does not have enforceable regulations for protection against infectious disease. They have some guidelines, but no enforceable regulation. And a lot of these health professionals are forced to be in situations, as you've seen on television, where the protective equipment is not there. And they're wearing garbage bags, they're making up stuff, they're wearing snorkel masks. I mean, it's this third world country, and they're still going in and providing the treatment. You've indicated they're getting sick. In one hospital in New York, 200 of the employees are sick. In one country, I think it was either Spain or Italy, about 14% of all of the cases are healthcare workers. So we know they need the protection. If we could get an OSHA regulation, when we had the AIDS epidemic about 30 years ago, they had regulations to protect yourself from blood. And you go in the hospital now, they've got little how to dispose of needles and a lot of other things that they're supposed to do, and they significantly reduce the transmission, the accidental transmission. We need to do the same thing because our healthcare workers need the protection. Now, in terms of out-of-pockets, we're trying to cover the out-of-pockets for everybody. If you have insurance, you still have the deductible, you have the co-pays and everything else. And unfortunately, we have not yet solved the surprise billing problem. And with doctors coming from out of state, there's no telling what that's going to look like. We need to provide coverage for treatment, not just the testing and the vaccines, but also the treatment for this disease, which would answer the question not only for the healthcare professionals, but for everybody. I would assume the hospitals are doing what they can to cover the expenses. I don't know, but it is certainly one that needs to be addressed. But the first thing we ought to do, and we tried to get the OSHA regulation in the bill we passed 2 weeks ago and the bill we passed Friday, but we were resisted when the administration wouldn't approve, said they wouldn't sign the bill if that was in there, so we had to take it out. But we're still pushing for OSHA protection so that the healthcare workers will have, OSHA can come in and enforce from a regulatory perspective, safe practices for our healthcare professionals.
And Congressman Scott, I could definitely answer that from Centerra's perspective. We are doing 100% everything we can for both those. Number one, making sure our healthcare workers are protected as best we can under the circumstances. That is our primary focus because, to everyone's point, without safe healthcare workers, we can't take care of other people. So that is our top priority as it relates to that. As it relates to the surprise billing, as it relates to healthcare workers when they get sick, we are obviously, as a healthcare employer, very focused on that to make sure that does not cause hardships as well.
Thank you.
Thank you, Maxine. And unfortunately, I think we only have time for one more question. But at first, I wanted to plug for everyone that the Congressman has spoken a lot tonight about the Coronavirus Aid, Relief, and Economic Security Act, commonly referred to as the CARES Act. You can find a lot of information about that bill and the direct cash payments on the Congressman's website at bobbyscott.house.gov/cares. Really simple. And one last note, we've been talking a lot tonight about how everyone's going to be spending some more time at home in the coming weeks, and I think this is a good time to remind everyone to please complete the census if you've not already done so. It can be filled out quickly and easily at 2020census.gov. Completing the census is critically important as lawmakers over the next decade, business owners, and many others will use the data to make critical decisions. So, moving to our last question, I think we're going to go to Bruce from Hampton. Bruce, you're on with Congressman Scott.
Thank you, Congressman. I want to thank you for dedicating your time and energy. I find this town hall very beneficial. Excuse me. I'm what's called a permanent tutor. I work for an elementary school, started last September, and I teach algebra and algebra readiness. I work 28 hours a week. I have an independent contract. Am I entitled to unemployment benefits? And if I am, how do I apply?
Okay, the part-time workers are entitled to proportionate unemployment based on whether it's a quarter or half of, you get a proportion of part-time. You'll apply with the Virginia Employment Commission, and people who are not technically employees have traditionally never been eligible for unemployment compensation. You have to be an employee. Now, people have probably missed all of the debate we've been having for the last 10 years about the difference between an employee and an independent contractor, where some people have been classified as independent contractors and have not been eligible for unemployment compensation, minimum wage, overtime, unemployment compensation, workers' compensation. They're kind of just on their own. And a lot of people have been, some delivery drivers for companies are independent contractors. Some doing the exact same job are actually employees. And we're finding out what a difference it makes. But we, in the legislation, covered gig workers, self-employed, so that if they can show that they're unemployed and not making money, they'll be entitled to the unemployment compensation, $600 a week. If you are eligible for state unemployment, you'll get that in addition to $600. Now, the regulations and all that haven't been drafted yet, so it may be a little while before that's actually available, but work with the unemployment compensation. But gig workers are, in fact, will be entitled to compensation. The independent contractors, the gig workers, the self-employed will all be eligible. Before we close, let me make another.
I think there's one last question we wanted to get to, Congressman.
Okay. Well, let me say a word about the census. The money that's coming into the communities under this bill will be based on the census 10 years ago. And so people who didn't fill out the forms 10 years ago are costing us money today. Let's not make that mistake. Fill out the forms so that everybody is counted and we can get our full complement of federal funds that we're entitled to. Austin?
Yep, and the last question for tonight comes from Hilton on Facebook, and he says that the percent of deaths seems currently low. Are people lying about the total impact of this disease?
Say it again.
The percent of total deaths right now is low. Are people lying about the actual impact of this disease?
Well, one of the things that the percentage of deaths people have to understand what exponential means, and that's why some of the happy face that people are putting on this situation is really misleading. We got this thing under control today. The number of deaths is not bad today. The problem is it's 10 times worse than it was 10 days ago, and by every indication it's going to be 10 days from now, it's going to be 10 times worse, and 10 days from now, 10 times worse than that. So if there are 2,000 and some today, it'll be 20-some thousand in 10 days and 200,000, and that is what the problem is, not the number of deaths today, because it's relatively modest, but the 200,000 or 2 million that you'll have by the end of next month. If we don't, there's an old adage that if you don't change directions, you will end up where you're headed. We're headed towards 2 million. If we don't bend the curve, that's exactly where we're going to end up. And that's why it is so important to comply with all of these draconian actions that the governor is imposing. If we don't do it, we're going to head right to 2 million. If we follow those directions, we can save a lot of lives.
And Congressman, I could not agree. Yes,
Dr. Asher?
I could not agree with you more. A small percentage of a very large number is still a very large number. And if you think about the total population, even in these areas, and you think about a spread throughout that entire population, and you're still multiplying it by what is considered by some a low percentage, that is still an incredibly high number that those of us in the healthcare world do not want to see. And that's what we're trying to prevent. And just to give it to Congressman Scott's logarithmic or how it grows exponentially, when we talk about the yearly flu and we see a lot of people die of the flu, that is occurring at 0.1%. And this is occurring at a much, much higher rate than that. So I really want to reiterate, and not trying to layer on, but a small percentage of an incredibly large number is an incredibly large number.
Thank you, Dr. Ashford. Dr. Lane, did you want to add any final comments?
No, Congressman, I just want to thank you again for having us and here to answer questions. And for the folks in Virginia, just know that we're looking out for your children and going to continue to do everything we can for them during this time.
Dr. Asher, final comment?
Everyone stay safe. Please abide by that we're asking everyone to do. We know it's tough times, and we will continue to focus on treating you and protecting our healthcare workers.
Well, thank you, and I want to thank everyone on the call. I'm sorry we couldn't get to every question, but we're going to have, as long as this thing goes on, we'll have town hall meetings about once a week to make sure that we keep up with the latest information. But this thing is growing exponentially. Like I said, 10 days, 10 times. If you go back 20 days, it was in double digits. It got up to 200 only about 10 days ago. And so that's the trajectory we're on. And that's why it's so important to comply with all these regulations that the governor has proposed. The governors who have proposed the strongest regulations are in states where the problem is the least. So I don't like Governor Northam's regulations any more than anybody else, but I recognize that he's saving lives. And so let's just get through this the best way we can. the unemployment compensation. Hopefully, the regulations will get set so that people won't lose their paychecks. I know the beginning of the month is in a couple of days, so we're working as quickly as we can to get those checks out. So thank you very much, and this ends the phone call.